Is lip filler dangerous? Lip filler is quickly becoming the #1 area that injectors inject. It still is #1 nasolabial folds because this is where people see the signs of aging. Lips are sexy, lips are trending, all your influencers have big lips, so people are getting lip fillers. Is it safe? Let's talk about #1. What are we putting in there? The #1 filler, and I use that term loosely, is going to be hyaluronic acid. That is the best lip filler of choice at this time. There are many different types. We'll go into that maybe later, and I have other videos on that, but be mindful. There are other things that are called fillers. PMMA, known as Articol, Artefill, and now Bellafill, and in other countries they just take PMMA molecules, mix it with collagen or whatever, put it in the lips. The nodule rate is way too high. It's over 10%. So in the United States, that's too dangerous. Hyaluronic acid is the one. PLLA Sculptor we never put in the lip. Calcium hydroxylapatite radius we never put in the lip. I never put in the lip, and I would never recommend it. So the type of filler is important. When we're talking safety, consider here, you want to get real filler. It's so important. You might go in and you can even see someone have a syringe that says Juvederm on it, but remember, they could backfill that up with whatever they want. If the Juvederm was used up, you take that syringe, you can refill the same syringe. So just the fact that you see a syringe that says Juvederm, it doesn't mean you're getting it. One of the best ways to tell is typically how much you pay. If you're paying what's out of keeping with the normal prices, you have to be concerned. Obviously go to a clinic where you trust the people, where they have your best interest in mind. A vial of lip filler in this country, hyaluronic acid filler, like Juvederm, like Restylane, Belotero, they would run about $800 per vial. That would be the average. As you go down, you wonder how they're getting those prices, and that would be definitely something to be concerned about. So that's #1 thing with safety. Let's go to #2, migration. Everyone wants to know. Hyaluronic acid products can migrate. And certainly one of the reasons for this, it's technique, it's how it's placed. So that's the experience and training of the provider, but also people are putting too much hyaluronic acid filler in, and thus it migrates. It is a real concern. Another reason is if you have very small lips. It's hard to take very small lips and make them big and plump. And if you do, you're trying to put filler in all the time. If you do it over stages, it's much more safe. #3 is technique. You want to go somewhere where they train, where they understand about fillers. The majority of people do not use micro cannulas for filler because it's hard to shape the lip perfectly. I use a combination. Sometimes I use a cannula, sometimes a needle, but it leads us to things like occlusion, where you block a blood vessel and it stops blood flow. You get necrosis or death of the tissue. With hyaluronic acids, nicely so, we can reverse this. If you're using one of the other products, they're not reversible. So keep that in mind. And it has to be found early. Symptoms and signs like whiteness, pain definitely indicates this pain of keeping with what we're doing. And you see an expert injector and you just be mindful of that. But no matter how good injectors are, this is something that's going to happen in the lifetime of an injector. I've had 3 in my career, and I've been doing this 25 years and tens of thousands, maybe even 100,000 lips. I don't know. But understand that doing this in the early 2000s, it was nothing to see 50 patients in a day. It's a lot harder to see that many now. It's more complex. The legalities surrounding it, all the paperwork, the pre and post pictures, we used to never have the extent of those things 25 years ago that we do now. So the majority of people don't see that number, but in my early days, that's what I did all day long, morning till night. The next thing with safety, you want to consider how much you want to do in one sitting. Of course, people have a lip and they look at it, they want bigger. Okay, so if you want a real big lip, you want to do that in stages. It's better to do 1 vial at a time, separating it by 4 to 6 weeks, than putting 2 vials in there at once. Especially a small lip, it just won't take that amount. You get too much pressure, too much migration, And potentially then, and this is controversial, but you could get an occlusion from external compression. So you got a vessel going and you got too much pressure on that vessel because the filler has nowhere to go. Some people don't believe that can happen. I think you can get mini necrosis from that, but that's much more easily reversed as well. And we have protocols for those things. Even massage can help that type of an occlusion versus the one where the product goes right into the vessel. The next consideration with safety is keep in mind you are putting a synthetic product into the body. This is, if you're using hyaluronic acid, it's bacterial, cross-linked, man-made synthetic product put into the body. Do we know what it does long-term? We have a very good idea because so much of it has been used. Are there problems with some fillers that come months and months later that are reactions? Yes. Are there infections that occur? And something called biofilm, where they're very resistant bacteria that are packaged neatly and kind of stuck down to that one area. They're hard to get at with antibiotics and so on. So there are problems that can occur delayed. Also, if you have autoimmune disorders where the body wants to attack itself, this is a foreign body. That's something to consider. Now let's consider 3 things where you should be even more cautious. Number 1, if you're doing this for symmetries, watch your dynamic symmetry. Lip fillers are less likely to help you with asymmetries that are caused from motor movement. So if you smile and you're off on your smile, quote unquote off, asymmetries can make people attractive, by the way, but people are obsessed with them and we shouldn't be often. But if you're going in for that, we don't change motor movement, so really have a good consult with a good provider. I often tell people, I'm just straight up, hey, this probably won't affect and help your asymmetry. For those that have static asymmetries, meaning asymmetries at rest, it's much more likely to help. Number 2, if you're going in for redness, if you want more pink, obviously red lips are attractive. And estrogen during phases of the woman's cycle, if we're talking women specifically, redness attracts a mate. So during high levels of estrogen, the lip is more pink. It's one of the things people like about fillers. Yes, it can happen with fillers. The lip can also be more white looking, or a Tyndall effect can occur, which is a bluish hue from the product. You have to inject lip filler superficially because the vessels that supply the lip are deeper. So by nature, it's a superficial injection. You need to know what product you're using. One caveat here, what I do a lot for people is plasma lip, which is PRF, platelet-rich fiber, and it's a blood draw. It's 100% natural. The other thing you can do, lip plumpers. They work fantastic. If you don't want to have lip fillers, you want to have all natural, plasma lip, and also topical. So lip plumpers placed on top with retinols, with stimulants that help immediately plump. That's why people love immediate. And also, of course, peptides. So my lip plumper and others, I'm sure, but mine has peptides, which are signals that tell the skin to rejuvenate, to build collagen, to improve the look. So topicals would be a way. The next reason I want you to consider twice if you're getting lip filler is if you're doing it instead of a lip lift. So many people, either genetically, as you're born with a long distance from the upper lip to the nose, we call it the ergotrid, and they want to shorten the distance. So they fill the lip and overfill it for balancing the face. They imbalance their face and overfill that upper lip to try and decrease that distance, and that can look bad. Sometimes the lip lift surgery is just better to do. Why does that distance get longer as we age? It's because the bone changes. It's one of the reasons. The bone changes, of course, you get laxity of the tissues, and you might perceive what we call a growth of that area or a lengthening of that area. Be mindful of doing too much lip filler to get rid of that look. It can work for some people, and everyone's a little different, but I would say 30 to 40% of the time it can help. 20% of the time it's a home run, and 50% of the time it won't meet the exact patient's needs. So there's percentages there. It's all based on the consult. The number one thing you can do is find a great provider, an experienced provider, and you'll know by the consult. Someone who looks at your face and looks at the whole face when you walk in. They go, hey, okay, let's talk upper lower face. A good provider is not trying to sell you something, they're trying to get you to see the big picture, and you want that. Lips balance the face. Lips are attractive, they're sexy, but big lips on a face that doesn't fit, on a face where the skin is wrinkled and not tight, where there's excessive sag, will never look good. Get a great consult. That's lip filler. I want to know in the comments below, do you love lip filler? Do you get it? What's the scoop? Stay tuned. Keep your skin and body beautiful, healthy, and vibrant.